How to hand wash using soap and water. Hand washing should take you about a minute. You may use a timer or count from 1 to 10 in each of the following steps. First is to wet your hands with water. Apply enough soap to cover all surfaces of the hands. Let the water run smoothly to avoid touching the top later on. Rub hands palm to obtain a good quantity of foam. Rub the right palm over the back of the left hand with interlaced fingers and vice versa. Rub again to palm with fingers interlaced. Rub the back of your fingers to opposing palms with fingers interlocked, repeating this action for each hand. Rub rotationally left thumb clasped in right palm and vice versa. To clean the tips of your fingers, rub rotationally backwards and forwards with clasped fingers of right hand in left palm and vice versa. Rinse hands thoroughly with running water. Dry hands thoroughly with a single-use towel or tissue. You use the towel or tissue to turn off the top without touching it directly to your hands. Your hands are now clean and safe.
So, what is donning? Donning implies putting on the appropriate clothing, equipment, and gear before having an interaction with a patient. These items must be put on in the following order. First, medical gown. Second, mask. Third, eye or face shield. And lastly, hand gloves. Doffing implies removing the appropriate clothing, equipment, and gear after having an interaction with a patient. These items must be removed in the following order: hand gloves, medical gown, eye or face shield, and mask. The significance of practicing the aseptic techniques demonstrated in this video is that they eradicate pathogens that may cause impurity. This is crucial in the field of dentistry as it can prevent infections, cross-contamination, and transmission of pathogens from one person to another. Moreover, doing these aseptic techniques heightens the possibility of success of a procedure or treatment in dentistry.
5 moments of hand washing. First is you need to use an alcohol-based sanitizer. Make sure to touch and sanitize every part of your hand. After sanitizing our hands, you need to wear a pair of hand gloves. And after being exposed to body fluid like saliva, properly dispose the protective hand gloves and use an alcohol-based sanitizer after. And here's what we'll do after touching a patient. Properly dispose the protective hand gloves. And wash your hands immediately with soap and running water. And here's what to do after touching a patient's surrounding. Properly dispose the protective gloves. And after, sanitize using an alcohol-based sanitizer.